Does it make a difference what dose someone is on in year 2 in terms of their weight loss? That's what we're talking about today and so many other things. Hi, I'm Dr. Meghan. I'm an obesity medicine physician and weight loss coach, helping you cut through the noise and pseudoscience in weight care. My approach combines evidence-based medicine with real behavioral change. So you don't just take medications, you actually transform your health. Stick around for clear, medically based answers to your weight questions. Welcome to Office Hours. Before we get started, as a caveat, of course, I can't answer personal medical questions because I'm not your personal doctor. So if your question does lean a little personal, I'm going to change it so it's more broadly educationally applicable. And as always, these questions come from the community. So if you have a question afterwards, you can leave it on this video, you can leave it on another video. I will find it and add it to the list. And if you're curious as to how weight loss coaching can help you take your results, especially if you're on a GLP-1, can help you take your results to the next level, I will leave all that info below, and let's get started. First question, I'm on shot 90. I'm at 15 milligrams of Zepbound and still 50 pounds from my goal. How do I get back to losing so I can get in a healthy range? Great question. Okay, so if somebody is, I will just kind of broaden this out. If I have a patient and they are on the maximum dose of Zepbound and they have been on it for a while, so a year, and let's say they want to lose 25, 40, 50 pounds, but they've been on the maximum dose for a while. The first thing I'm going to do is calculate their total body weight loss, because if their weight has plateaued, meaning they've hit their weight hasn't moved for a while, I also want to see, okay, are we where we think we should be? Are we hitting the average total body weight loss for this medication? And that really helps, because if I have a patient who, and I'll leave a link, I'll leave the equation on how to do this down below. It's very simple to do, but it's definitely worth calculating if you haven't done this for yourself before. It's worth seeing the difference so you can figure this out for yourself. If they have achieved, let's say for Zepbound, let's say that my patient has achieved 20% total body weight loss. They've been at the 15. They've been tolerating it. Nothing has really changed in terms of their weight or in terms of other things they're doing for a while, and it's just keeping them stable. Then I can say, okay, probably around here is as far as the medication is going to take them. That means that I'm going to need to start to look at other areas, whether it's other medications, other lifestyle things, maybe bariatric surgery. I need to look at what else other than this medication is going to help me help this person get to their goal. Now, let's say I calculate their total body weight loss on Zepbound, and they've only actually lost 10% of their total body weight. Okay, that is surprising. So that means I'm going to back up a little bit and say, okay, what is interfering possibly with this medication doing the best job that it can? So for some people, it might be they have other medical issues going on, people with diabetes, untreated sleep apnea, untreated hypothyroid issues. Like, there are many different medical issues that can cause weight gain. And I really want to make sure that I've addressed or found anything that's kind of hiding in the background or hiding in plain sight, as it may be. So that I've really addressed that. I also want to look at their medications, because maybe they've been on something the whole time that I know is going to be competing with that weight, with the Zepbound working to its fullest potential. Or maybe they weren't on any other medications for a while, but recently they started a medication that could be competing with that in terms of getting them the best effect. So that's a really important place to look as well. I'm also going to be looking at, okay, this person, how are we doing in terms of eating? Is this somebody who has a lot of overeating tendencies to the point where that might be itself its own issue that we may need to address in addition to the weight? Is that part of their life really optimized? So if somebody is getting suboptimal or below average results, those are places I will look. And then of course, there are some people that are just not going to respond as strongly. So that's kind of a diagnosis of exclusion, I would say, in terms of if I've looked at everything else and really everything else is pretty optimized, they might just be at the other end of the bell curve in terms of there are some people that aren't going to lose as much weight on this medication. There are people, rarely, who are going to gain weight on this medication. It doesn't happen a lot, but there are, it's few and far between, but it does exist. It does happen. So then that might be somebody that maybe this isn't the right fit for them. Maybe we need to think about other things. So those are really the places where I would start. Also, whenever somebody's setting a weight goal, I think it's really important when they're talking with their physician that they're talking about what the goal is, but also why that goal. And I think you really want to like your reasons. Your physician should like your reasons. Like you should both be on the same page. But I think, some people, their reasons have nothing to do with the number, actually. Some people, their goal is, I want to be able to, sit on an airplane comfortably. I want to be able to buckle my seatbelt comfortably. Like those are the goals for them. And so if we're looking at that, I think that also gives us other perspective in terms of, okay, have we achieved those? Maybe the number isn't matching up, but what other goals have we gotten to so far? So you just want to make sure that you and your physician are on the same page in terms of this being a healthy goal that you both agree on is going to get you to a safe, healthy place. And then finally, for the right person, if I've optimized everything for them on their medication and they've lost 20, maybe 25% of their total body weight, and eating wise, everything is really where they want it to be. And exercise, everything is really where they want it to be. But goal wise, like let's say they're 50, 75, still 100 pounds away from their goal. That is also somebody that I probably will have a conversation with about bariatrics, because it is just another tool that for some people can really be helpful. It's not going to be for everybody, but I think as always, I am just so invested in people knowing what their options are. So I think for the right person, it really is worth exploring as an additional tool to help get them where they need to go. That's really the thought process I would go through in terms of, I have a patient, this is where they are, this is where the goal is, now what, right? So thank you so much. That was an excellent question. I think a lot of people have that question too. Next question. Okay, this person's on Ozempic, 2 milligrams a week, no weight loss, but good for their A1C. Is weight loss potential inhibited by beta blocker? Great question. So beta blockers are a category of medication that potentially can interfere with weight loss or can cause weight gain. In my clinical experience, it hasn't been as troublesome as other medications, but it certainly is potentially slightly disruptive. Now, for me, in terms of, on the scale of least to most troublesome, I would probably put it at the lower end. It's not like a medication, like some of the antipsychotic medications where people can gain like 50 pounds, 100 pounds, but there can be some modest weight gain, and there are some studies that show that as well. So I think it's not one that we typically think of as contributing to weight gain, but it is potentially something that could be fighting. Do I think it's going to be really prevent somebody from having any kind of weight loss at all on a medication? No, I think it's definitely, for most people, I would not be suspecting that, if they weren't getting results, that was the one thing. But it also depends on, what the dose is for somebody. If their beta blocker was really high, it could potentially be an impediment. So the answer to that question, the broad question of do beta blockers cause weight gain, the answer is yes. In terms of how much it's going to interfere with somebody's particular results, I think it's a really case-by-case scenario. Depends on the type of beta blocker, depends on the dose, and depends on the weight medication that they're on. Also depends on, if somebody is on a beta blocker and has diabetes, those are two things that are not going to give them great results. Or not going to maybe optimize their results that they'd have necessarily on a GLP-1 medication. But the short answer to that question is beta blockers could potentially inhibit weight loss on one of these medications. But I usually don't expect it to obliterate somebody's chances of being successful on the medications. But that is a great conversation. If you are somebody out there on a beta blocker, this is a good conversation to continue with your doctor if you are also on one of these medications. So great question. Thank you so much. One thing I'm curious about is, does it make a difference what dose someone is on in year 2? Okay, so this is about the video I recently made about weight medication in year 2. Someone who is down 20% at 15 milligrams versus someone who is down 20% at 7.5 milligrams. If they're both at year 2 and everything else being equal, would they both have the possibility of not going further than 20%? Or would the person on 7.5 milligrams and slowly titrating up have a better chance to continue losing if they have a goal of around 40%? Okay, that is such a good question. So really, what we have seen from the research is that these medications are dose dependent, meaning the higher up you go, the more weight we can expect to lose. So if year 2, there's one person who's lost 20% at 15 milligrams, and there's somebody who's lost 20% at 7.5 milligrams, and they're still titrating up, I would be expecting that patient probably to lose more. I'm expecting they're at 10, they're going to lose more, at 12.5 and at 15. Now, I can't predict the future, but if they've already lost 20% and they want to lose more, and that's something that we feel like is a healthy, safe goal for them, then I would definitely expect them to continue to lose weight at higher doses, regardless of how long they have been on that 7.5 milligram. I'm still thinking, if they've been on that for 3 months or 6 months, and then they bump it up, I'm expecting them to lose more weight as they go up. So the answer to that question is yes, I would anticipate that 7.5 person would continue to lose weight, and the 15 milligram person, if they've stayed there and they have found their new normal and it hasn't really moved. Again, the research we have, not a lot, but the studies that we have suggest that you could continue to lose a little bit more afterwards, but that's not a person I'm expecting to lose 40%. I'm not expecting them to have the same percent weight loss as that 7.5 milligram person, who I would anticipate would lose quite a bit more. This was a follow-up question to this comment, which is somebody said, I was disappointed to, this was also on the year 2 video, GLPs, year 2 on GLP-1s. I was disappointed to hear her say that after the 20%, additional loss isn't likely and that the food noise is going to be a part of life. And I just wanted to clarify that, because from that last question, it really depends on the dose. So if somebody's on that maximum dose and they've lost 20% and they've been on that for a while, maybe 3 months, 6 months, there may be some wiggle room just in terms of the medication and how far it's going to get them. That's probably about where they're going to end up. They may lose a little bit more. Like I said, in the studies that we had, like the SURMOUNT-4 study, people actually ended up being closer to 25%. So you may get a little bit more, but I'm not expecting a lot of weight loss after that. But so it really depends on the dose. Again, if that person's on the 7.5 and they've lost the 20%, I'm anticipating they're probably going to continue to lose more. I just tell people to, anticipate that it may change. And your first couple months on the medication, it's not really how you're going to feel, by month 12 or month 24. So your appetite is probably going to be a little different. It's probably going to be a little bit more normal, not identical usually to how it was before, but not completely suppressed if that's what happened to you with the first couple shots. And then the food noise, same thing, like it could come back a little bit. And I just don't want people to think that means things aren't working. It means your body's adjusting, but it doesn't necessarily it doesn't mean that the weight is coming back on and there's nothing you can do about it and it stopped working. Like don't go down that mental rabbit hole. But your body is adjusting this medication over time, and part of that adjustment may be, okay, how you look at food, the food noise may come back a little bit, but usually is not to the same extent. And you just want to make sure that whatever you're doing your part to minimize it. So the foods that you're eating are also, the majority of the foods that you're eating are also foods that aren't going to, bring food noise on in terms of processed foods and things like that. That is an excellent comment, and thank you for following up with that. If you have a question afterwards, you can definitely leave it on this video and I will add it to the list. And if you want to take your results to the next level, if you feel like I am on a GLP-1, but I'm leaving results on the table because I can't get my eating where I want it to be, I can't get my exercise where I want it to be, these are all things that can be fixed. And I do this for people all the time. So if you want to hear more about how to maximize your results on the medication, I will leave all that info down below. Thank you so much for watching, and please be well.